Hello everyone, I am Dr. Swapnil, your brain and spine doctor. So today we will discuss something that is affecting so many millions of people, often silently, often overlooked, a common clinical condition, that is migraine. So what exactly is migraine? Generally, it is a very broader term which has been used. Most of the patient, they come with a recurrent headaches. The headaches generally will be in one side of the head. It can last from almost 4 to 72 hours. It can be associated with sometimes the vision symptoms, sometimes with an aura. So the presentation definitely differs from patient to patient, but one of the most common things is they have a more sensitivity to light or a increased sound. So why exactly you have this kind of headache? The most common proposed theory which has been explained for having this type of headache is there is a change in the brain chemicals like serotonin which are there in your normal brain, a change in those chemical, or if there is an inflammation inside which causing it the more sensitivity to the brain, and sometimes the patient may have a genetic predisposition. Because of this, the patient may have continuous headaches related to migraine. But most importantly, what you have to understand is there is a trigger which is related with headache, which causes most of the time, which triggers this headache. So commonly, which are the triggers which causes this headache is, first is the food. You take proper food, the food is not on schedule, or you have taken extra spicy food, or the food which is not suitable to you. Sleep, too less sleep or too more sleep, that is also a common cause. Third is the stress, which is also related to this thing, stress which is also related to causing you headache. Fourth is improper travel habits, excessive traveling, or that also can be related to your headache cause. So how do you diagnose this migraine? Generally, as such, there is no specific test which is available to diagnose migraine. The doctor will be clearly evaluating your history and your symptoms and can make out a diagnosis. If the symptoms are so disabling, definitely a brain scan will be done so that we rule out that there is nothing problem in your brain and it is clearly a migraine. So what treatment definitely you should take is, if the headache is so severe or it is disturbing your quality of life, then you should consult your doctor. You will be started with some of the medications which will be helpful for you to, so that your headache subsides, and it will help you to avoid the future headache recurrent attacks as well. So how do you prevent this attacks, or how do you have this relief from headache permanent? So best thing is, like, first thing what you have to do is a lifestyle change. You should know what triggers headache or a migraine in you. You have to avoid such of the food objects like hot or cold objects, or a cheese or chocolate, whichever is the trigger to your headache, you should avoid. You should have a proper sleep. Stress definitely should be adjusted. And like, if you have a headache specifically on going to hot temperatures or cold temperatures, better to avoid such travelings also. And like with all these things, definitely you can bring your headache under control.